Yes, hi, good morning, everyone. Thanks for joining me. Over the last few months, it's been no secret that the Board of Nursing has had delays in issuing licenses for applicants, particularly the huge number of endorsement applicants who were here on an emergency authorization, but that now need a permanent Oregon license in order to stay in Oregon. The there's only so many things that a licensing system can do, and I want to give you some background into what the board must do by law in order to issue someone a license, and what the pain points are, and what some possible solutions could be in the future. And the solutions to changing anything, of course, are legislatively mandated because the board has to perform the duties that the legislature has demanded of it. So, Jana, next slide, please. Okay, so what we do. So again, the board is mandated to do specific things by the state legislature. The statute that guides the Board of Nursing is Oregon Revised Statute number 678. And you can see here that we have to determine all the qualifications for a license to practice nursing and establish not only professional standards, but also educational standards. We are the only board in this state that is authorized to establish educational programs and approve nursing programs. While we do not accredit nursing programs, if a program is not approved by the Board of Nursing, then its graduates cannot sit for the national nursing exam. So if somebody wants a program to just educate nurses to an N degree and then off they go into doing something else, they don't need board approval. But if they want to sit for the NCLEX, then yes, needs board approval. And again, that was legislatively mandated. There's our mission statement. We are not an advocate organization. We are not the spokesperson for nursing. We are the spokesperson for public safety in nursing. And a lot of individuals, when I talk to groups and I say, the board is responsible for, safe practice, safe staffing, sometimes I get challenged in that people will say, well, you want nurses to do more than just safety. Well, of course, as a nurse, I want that. But as a regulator, what we are looking for is safe practice. That is the minimum standard, and that is the floor of nursing. It's safety. Anything other than safety is an enhancement that professionals bring to the table, bring to their patient. But the Board of Nursing is about safe practice and decision-making on the part of the nurse to assure that their patient gets safe care. And quite frankly, unfortunately, it's regardless of what the situation is. There are always mitigating and aggravating circumstances the board looks at, but at the end of the day, what decision did the nurse make? Next slide, please. Okay, so by statute, what is required to be awarded a license? And once you are awarded a license in Oregon, it is called a property right. And you can take that property right and go make a living and pay taxes and buy a house and contribute to society overall. And that property right, in order for you to have that, you have to meet certain barriers. You have to certain hurdles you have to get past. Now, a lot of people say, why do I need to do all this? Because I have education and I did pass the NCLEX. There are still certain things that you must show to the board in order for you to qualify for a license. Not many people, but there have been some who went to nursing school, passed the NCLEX, and the board denied them their license because of other factors. And so these are the factors that are most pertinent. So Oregon Revised Statute 678 says you must be graduated from a nursing program in the US, or if you are graduated from another country, show evidence that education is equivalent to that of the US. And that requires quite a bit of work on the part of the individual educated in another country. Since 2018, 19, one of those years, individuals from Canada have also taken the NCLEX. Therefore, individuals coming into Oregon from Canada are not considered foreign educated nurses. They are considered nurses that have shown minimum competency through taking the US NCLEX. Also, Singapore, UK, those kind of countries are considering also taking the NCLEX. And once they take the NCLEX in English, they will be, we will look at making them not be considered foreign educated. Okay, then the other statute says you must pass a nursing exam. And for candidates endorsing into Oregon, pass the examination in their home state and establish competency. So this is where a lot of individuals who are for endorsement licenses get hung up, because they do have to show that at one point they did pass a nursing exam, whether it was the NCLEX or the test that came before the NCLEX. I did not take the NCLEX. I took another test because I've been a nurse for so long, but I have to prove still when I got to Oregon that I had passed a nursing exam of some type. Sometimes that takes a little bit of digging on the part of the individual getting the endorsement license, but hold on a second here. Okay. Yes, I told Jana that anything the board does, anytime the board comes and talks to any group, it is public property. We are a public institution. We are a public body. Therefore, anything we say to you is you can disseminate it in any way you want. Okay, so again, pass their home state and establish competency. In Oregon, people establish competency not by continuing education units, although the legislature does throw continuing education units frequently at healthcare workers, and the Board of Nursing is responsible for determining that. The Board of Nursing itself does not require any CEUs to establish competency. In Oregon, you establish competency by practice. So anyone coming into Oregon has to establish that they have had the right number of practice hours, which currently sits at 400 hours of practice every 2 years. Then you have ORS 678.111, and this is the place where it gets a little sticky and where there are a lot of delays. Demonstrate through background check and disclosure that the applicant does not demonstrate a possible cause for denial. All cases are determined on an individual basis through additional review or investigation. So when you fill out an application and you say, yeah, I was arrested, back in 2010, whatever, we do have to look at that. There is a board approved list in Division 1 of the Practice Act that talks about how we vet those background checks and what we look for. And again, every single case is case by case. There is no bar in Oregon. In other words, if you disclose something on your application, it doesn't stop the application at all. It will go through the investigation process. And unfortunately, once you go into the investigation process, or your applicant goes in, if you're an institution and you're wondering why the applicant isn't getting their license and they are told it's in review, that's because there's something there, and we are not authorized to issue the license until that item is reviewed and resolved. Next, please, Jana. Okay, so here are this presentation I prepared for the House Committee on Healthcare. So it is based upon the numbers we collected back in September. You can see the number of registered nurses. There are 80,000 registered licenses, okay? Because again, we talk about how many licenses we manage rather than the number of people, because of course all advanced practice nurses also have a registered nurse license. So there's some double counting, and all certified medication aides must be nursing assistants. So there is some double counting. So instead of counting people, we count the number of licenses that we manage. RN licenses, 80,000. It's anybody's guess on any given day how many of those actually are practicing in Oregon, or how many are actually practicing, period. But that's the number of licenses we have. Notice the number of licensed practical nurses has really declined in Oregon over the last few years. And again, I think there is interest in the board putting together a in-service about the difference between RN, LPN, CNA practice, et cetera. So please, as soon as we can get that scheduled, I'll let Jana know, and we'll, of course, post it on our website. Because I think that as we look at new models of nursing, we have to really think about what is available and also let go of some preconceptions about what an LPN versus an RN versus a CNA can do. Okay, so total licenses that we manage, 113,000 as of September 20th. It is a bit more now, but those numbers are indicative of the kind of licenses that we have to manage. And remember, all those people need to renew their licenses too. So, okay, next, Jana, please. Types of applications. Here are the types of applications. I'm not going to read them to you, but these are the different types of applications that are handled by our licensing department. There are 11 people that work in our licensing department, and they divvy up all these types of licenses based upon volume. The endorsement is our heaviest volume of licensing, and there are 2 technicians that actually work on those licenses. Initial license by examination also has 2 technicians seasonally. And the off-season, those individuals work on renewals, and reinstatements are particularly difficult after revocation or voluntary surrender, because in Oregon, if the board revokes your license, you can appeal that revocation after 3 years, but you have to show an awful lot of remediation, and there has to be an investigation, and that does not take over, that takes longer than overnight. So anyway, limited liability, RNFA, those are the things that we also manage. Next, please, Jana. Okay, so here is some data that we have, which shows that in January, February, March, especially March, April, May, we were really, really lagging behind. So of the 13, applications come in at certain times, and we work applications as they are received. So we will never issue the same number of applications we've received, because they will overlap months, and some take longer than others. But you can really see that in January of 22, we were really, really behind. And around February, March is where the governor started talking about lifting her emergency declarations, and the emergency authorizations would expire. So you can see in March, March was a record month. Those were, we had 2,738 nursing applications brought in, and we were only able to issue about 1,000, which is a real deficit and not adequate to meet the needs. So around April, May, June, we did a couple of things. We promoted everyone in the licensing department and educated them all to be able to verify documents. And you'll see in a minute why that's so important, the verification of documents. It used to be that only a few people in licensing could do that, but clearly, again, when you are faced with such a crisis, you've got to think outside the box, and you've got to put in a new model. We also went to the emergency board of the state legislature to ask for 2 additional positions, which they granted us, and we did hire those 2 additional. And you can see that starting in June, July, and August, we actually are catching up a little bit. We were at some point almost 3 months behind by the time the individual applied with the time that the tech even looked at the application. That's not acceptable, not okay. So again, we had to think outside of what is it that we normally do and what can we do. The resources are not finite. We cannot hire individuals because we have a need. We can only hire individuals when the legislature gives us that approval. So we had to go to the e-board. They were very generous with us. They said, yes, we recognize the problem. So we are slowly catching up. We are currently about 3.5, sometimes 3 weeks out from the time the individual applies to the time the tech actually has a chance to look at that license application and start working it and informing the individual of what it is they still need and what we're waiting for, or whether there's an issue with their license application. Next, please, Jana. Okay, our pain points. So most of our processes, particularly when the pandemic hit, we did what other people did. We went virtual, et cetera. All our licensing processes were electronic. However, whenever the process needs to be interrupted for a human to read the documents and verify, there is going to be a delay. And as you see where we talked about what was needed, we have to verify that the transcript is valid and accurate. The number of fraudulent transcripts is rampant in this country, or other countries too, but we know what we know about. It's rampant. There are schools that are mostly your proprietary schools. They not your not proprietary schools like uh, religious-based schools or whatever, but these are for-profit proprietary schools that have just sprung up, particularly in the state of Florida, have sprung up, and they actually sell. You can buy an RN transcript, a forged transcript, for about $17,000 and an LPN transcript for about $10,000. So we need to look at those transcripts. We need to look at the fingerprints. We need to look at whether or not you've taken the exam or not. There's nothing electronic that we know of that can scan that and verify it as a human being can. So in the process, it's not just a matter of gathering the data and off you go. It's a matter of a human being going in, actually physically looking at all the documents and verifying that they are correct. Applicants will also delay in requesting documents to be sent to the OSBN. Mostly the problem is with transcripts, particularly if the school is no longer in business. And yes, even if you've been a nurse for 40 years and you come into Oregon, you have to show us the original transcript that allowed you to sit for the exam. Is that a point that the legislature can change? Maybe they can, but there's also, again, that fraudulent business of transcripts that we have. And we just really need to make sure that, again, until the legislature changes the requirements, the Board of Nursing must abide by those requirements. Again, they think they've requested their transcript, but they didn't, or that they have applied with nurses to send us the license verification, but they didn't. So then there's also the abandoning of applications without OSBN notification. So all those numbers that I showed you about individuals applying, there, especially since this pandemic, we have noticed that people were told the travelers were told by their employer, you need to apply for a license, and they go, sure, sure, sure. They go ahead and apply for their license, which their agency pays for, by the way, most of them. And then they have no intention of finishing it. So we have all these license applications out there that no one is working on, and yet for our statistics, it looks like they are in progress. That is not the majority. That is not the reason we're behind, or the data shows we're behind. We were behind because we were genuinely behind. No legislative authorization to award graduate permits. This is something that Oregon eliminated from its statute several years ago. This is something that I believe if we bring this back, it will be a huge help to the healthcare organizations, because right now, if you're waiting to start an internship or a residency program, you have to wait till those people are licensed, because you cannot put them out on the floors or on the units, even for just observation, unless they are licensed in the state of Oregon. So if we allow from the day the person graduates a graduate permit, they can actually begin their residency, their orientation, their whatever on the day after they graduate. Currently, that is not possible in Oregon, but this is definitely something that my staff will look at during not this legislative session, but we are trying, because we've already done all of our options as far as introducing legislation. However, if we can get a legislator to carry that, we can possibly do it in the 23 to 25 session, because I believe that will help get people into the workforce a lot faster. It may not increase the number, but clearly organizations can start their residency, intern, orientation programs a whole lot sooner and get people into the workforce. And like everyone else, staff turnover and absence has been a huge issue for the board. People have bona fide FMLAs. I think every employer that's on this call knows the value of having those kind of benefits for their employees. The fact that a job is a job and life is permanent. but you also know the other side of that people call in. And when you only have 11 people working on a process, you have 2 or 3 people out, and maybe through bona fide illnesses or maybe through approved vacations and all of that, you really do start having a backlog issue. So with the temporary or with the limited duration employees that the legislature gave us, it doesn't quite impact as much, but it still impacts us like any other organization. Okay, next, Jana, please. FAQs, current processing time. People ask us that all the time, and we cannot predict it. We are unable to calculate because it's dependent on so many things. If we get 3,000 documents delivered to us within 1 month, and as I said, a human being has to look at those documents and verify them, you have delays. If we don't have a lot of documents, or everybody shows up for work and they do what there's, and that's one of the reasons why we promoted everyone in the licensing department to a classification that is authorized to validate documents. In the state hierarchy, some positions can do that sort of work and some positions can't. So we were able to promote everyone to do that. So that's one of the things that has helped. But again, it is impossible to calculate how much time, because that's the big question people have. How long does it take? I don't know. Depends on how the documents are delivered to us, whether the endorsement candidate is on the spot and does what they're supposed to do. There was a time when we were able to, before the pandemic, we were able to, if an endorsement licensee was really on the spot and got their fingerprints and everything, it would be 2 weeks. Now it's a lot longer because there's a lot more documents that are being delivered to us. What is the benchmark? So while we cannot predict how long it will take us to get a license issued, what we can do is say how long before the tech even starts working that license. And in our agency, it has always been 2 weeks from the time the person gets, because again, while that technician is while those applications are being submitted, that technician is working applications that are currently in progress. So in order for them to work the applications that are currently in process, they have to stop looking at the brand new applications until they can at least process some of those other applications to their endpoint, which is issuing a license. And then they go back and then they look at the new applications that have come in. And by statute, the board must look at applications as they are submitted. So if you submitted an application 2 weeks before your friend did, your application is going to get seen first before your friend's application, because again, we have to take them in the order in which they were submitted. But again, at the same time, we're still processing applications that are in the works before we look at the new ones. So anyway, that's what the licensing tech does. Current processing time, new grads, we're up to date, not a problem with new grads. A lot of them, the delay for them is registering with Pearson VUE. Endorsements, 32 days from receipt of being worked. This was 90 days in April. Currently, again, the last data I had from my staff is that we are about 3.5 to 4 weeks out. CNAs, 3 weeks from the time of receipt to being worked, and renewals, they're automatic. Renewals are done automatically unless there is an exception, such as you didn't pay for your renewal or something in your application was awry. So those applications are automatic. Jana, please, thank you. What the board has done, again, we have 2 LD positions, again, increased role authority. We moved to all electronic applications. However, again, there is no electronic process for validating documents. We have cross-trained staff. For example, we have about 6,000 APRNs in this state, and we move that individual also helping with reactivations, and those are individuals who have let their organ license lapse and they want to reactivate and go back into the workforce. So we knew that that was a need, so we moved people around. And the formula really is quite simple. Increased volume plus need for human intervention will create a backlog. So you get more humans in the intervention or you get more electronic processes in the intervention, it can keep up with volume. If you can't do that, the higher the volume, the more the backlog is going to be. Next. Okay. No, next, the other way, the other next. Okay, solutions. All right, so a lot of people have said to us, why don't you just, why do we have to have such an onerous system? So, okay, the solutions are, let's change some of the verification requirements. Again, fraudulent documents. Some of these documents look oh so real, but then you realize that for a 4-hour course, they got this number of credits, but for another 4-hour course, they got a whole lot more credits, or the classes are not in the right sequencing, or there was no clinical component to it, and only a human being can really look at that. I'm not saying that our staff catches everything, but we have given them education and we have given them tips from other states and from the FBI about how to determine whether something is fraudulent or not, some of those key components. So it does take a human being to look at that. So do we want to get rid of transcripts? That's an option the legislature always has. This is the downside to that. The upside to that is less human intervention, greater transparency. Greater movement of applications. Criminal background check. Do we want to let go of the criminal background check? The problem with that is that healthcare workers are working with people when they are at their most vulnerable, and that's probably not something you want. Again, the state of Oregon has a very liberal, there are no bars to applying for a license. Everything is looked at individually, and because everything is looked at individually, it goes to investigations, and again, there's another delay. Testing, you want to get rid of the nursing testing exam. That establishes entry-level competency to practice safely. Again, this is about public safety. License verification. So the inability to determine if other states have placed discipline on the license. One of the reasons we do license verification is we also get information from those states whether that individual has ever been disciplined and for what. So if we want to let go of any of that, those are some of the downtimes. Washington was mandated to do it in 7 days, but what they did was they didn't do safety checks. They didn't do checks for license verification, and it will not solve the staffing shortage issue, because the staffing shortage issue is really not about delays in licensing. It is about all the things on the huddle that we have been talking about for all this time. Next, I think that might be it. Nope, that's it. Is that all I have? Okay, that's all I have. Again,
thank you. I'm gonna take it off of the share screen. So okay. Yes, continue, Ruby. Sorry.
Oh, but again, I think that there are some things we can do. Particularly, I think the grad permit is the number one thing. House Bill 4003, where the nurse intern was going to be, did not turn out the way we had hoped and the way Rachel Prusak had hoped. The way it's written is very cumbersome, and we are hopeful that somebody in the next session or the session after that will look at that and go, that really doesn't help us. We don't anticipate the way it had to be written by the statute that there would be very many people who apply for a nurse internship. I think the grad permit really is what will allow us to get people in the workforce faster, and that's really the one I think we need to push further. Again, if the legislature decides to decrease the checks and verifications and all of that, the board will do that. Again, public safety versus any nurse will do. Just get me a nurse. So.
All right. Okay. All right. Thanks, Ruby. And we are at time right now. So if anybody needs to jump off, yes, the recording will be available. We'll have it posted on our YouTube channel early next week. Ruby, can you stick around for a few minutes in case anybody has any questions? So yes, if you need to step off, thanks very much for joining us today. But if you can stick around, if anyone has any questions for Ruby, go ahead and put them in the chat, or use the reactions to raise your hand, or take yourself off of you put on your camera and I'll know that's you, Carol Easter. I don't know. Oh, no, see, like, wait, I don't know. Carol, did you have a question? No. Okay. Well, then don't do what Carol did. So does anybody have any questions?
I'm sure for a lot of people, this is nothing new.
Yeah,
Yeah, you've
looks
been
like
living
Cindy's
it.
got a question. Go ahead, Cindy.
Okay.
Hi, Jenna. Thank you. Thanks, Ruby, for doing this. I really appreciate you taking the time to do this. This is something from our perspective, we certainly do this, work with this on a day-to-day basis. The question that we often get is we're hiring RNs and they're waiting, and even CNAs, when they're waiting for their licenses and certifications, they ask us for hints or things that they can do to help speed up the process or help keep the process moving. Do you have a few things that you could just highlight? Like, these are the things that we see that really make it easy for your staff to get things done quickly and to move through quickly, so we can start educating our candidates who either haven't applied yet or in the early stages, so we can help them move that through the process quickly.
Right. When they apply for a license, and I don't mean this facetiously, I don't mean this in any disrespect, read the directions. Because that's really where people, there's a lot of directions. And when you have directions that have too many words, people tend to skim. And when you skim, the literature shows you're actually reading at a third grade level. And our instructions are written really at an 8th grade level. So read the directions, use the directions as a checklist. If it asks for a document, go find that document. Even before you apply, go find that document. When you apply with us, you will get a next step email from us. The next step email has a code in it that is required when you get your fingerprints, because the vendor field print who does our fingerprints for us must have that code in order for it to correctly route back to our background check system. Without that code, it gets lost in the Ethernet. Get your fingerprints as soon as possible, because again, they go to OSP, the Oregon State Police, who then sends them to the FBI. The FBI sends them back to OSP, and then they send them to us. So if they do not get that email within a day or two after they have applied, they need to check their spam, their junk mail, whatever, because the state system, for some reason, some of the web browsers don't like the state system, and they will sequester any email coming from the state into spam or junk or whatever. So please make sure that your people they should get that email within a day or two after they apply, because it's automatically generated. And that code is absolutely important. Get your documents before you start to apply, and again, follow the directions. The other thing for new grads is register with Pearson VUE before you ever even graduate, because you can register with Pearson VUE. What will happen is, once the board gets your application, your payment, and once we get the verification from your dean or program director that you have graduated, we will release you to test. There are some new grads that are really on it, and the moment we look at their application, we release them to test because they have everything. And some, we do a process every day with Pearson VUE that tells us who from our state has registered, and then we match that with who has put in an application. You cannot be released to test unless you apply with us first. So those are some of the things. Don't call us all the time, and don't ask us, I'm starting a job on Tuesday, I have to have my license today. It doesn't work that way. Again, the statute says we have to process them in the order received. And again, this is why I think the new grad permit will be so helpful, because you can actually start orienting the day after you graduate if that's what you want to do. So those are really the big tips. There's also a status wizard on our website, on the nursing portal, that says exactly what has been received and what has been validated. it is really important that just because the board received your document doesn't mean that's the end of the story. Someone still has to look at that document. And if somebody is able to invent an optical reader that can validate fraud from not fraud, please invent that so that we can get, because anytime you get human beings into the mix, you're going to have a delay because it has to be taken out of the electronic system and somebody actually has to look at it. So those are really the big things. Apply early, register for your tests early. CNAs are probably not going to be able to register for their exam until they graduate. The CNAs really are not that big of an issue in terms of waiting for graduate testing. The CNAs, sometimes they have some issues with being able to read the documents because a lot of them have English as a second language. And in November, the board is going to hear about what we can do to lower the barriers to people becoming a CNA. There's a long story that we don't have time to go into today, but CNAs really do have a disadvantage if you want to be a CNA in Oregon compared to being a CNA in Washington or California or any of our neighboring states. The requirements in Oregon are so much higher, and there is no data to show that we have any better outcomes because it requires so much from our CNAs. So CNAs, if they do have, there's nothing that prevents an organization from assisting their graduates or their new employees on these tips and tricks and giving them resources to help fill out the application. The thing is, though, that you cannot, by law, fill out the application for them because there's an attestation at the bottom saying, I filled it out, even though every travel agency in this country probably violates that because they fill it out for their travelers, that they have filled it out. So I cannot say you can fill it out for them. I'm saying that this attestation is the attestation and they are held accountable for it. So if you want to do a workshop with your people about this is the tips and tricks for all of that, that's great. But the number one thing is read all the directions. And then it tells you everything step by step by step. So
sounds good.
Thank you for that. Thank you for that question. Okay. Well, you have my email. Let me know. And again, I will let you all know when we have the conversation about the difference between RN, LPN, and CNA. I think that's possibly a big thing people need to look at when they are changing their model of care.
Yeah.
And it makes the RNs in the state very, very nervous.
Right.
Am I going to be responsible for the LPN now, in addition to everything else? So anyway, okay.
Have a wonderful, wonderful Friday. Have a great weekend, and we will talk to you all soon.